most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
We're ready to go. I'm Brad Heineck, physical therapist.
Together, we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about 2 key exercises to rapid recovery for total knee replacement.
Right.
So, Brad and I have seen, maybe 3 patients between the 2 of us?
Yeah, like 3,000.
Yeah,
we've done thousands.
We've done thousands of patients.
Total knees we're talking about.
Yeah, that have had their knees replaced, and so we've seen it all.
Right. And we feel real confident in what we're saying here.
Well, are you going to talk some more? By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media channels and our website, bobandbrad.com, because we're always giving something away. And right now, we're giving away 2 foam rollers. I think they're going to be the blue type.
Yep.
By OPTP, really a nice texture to this.
Yeah, that's nice
consistency.
Yeah. This is their top quality, high-end one.
Yeah. So just go to bobandbrad.com, go to the giveaway section, and you'll find a way to sign up for it, or go to Bob and Brad, the Facebook.
Yep.
And make sure you like us, because Brad and I, remember this, we weren't liked as children. Nobody liked us.
Well, that's what Bob always says. My mom liked me.
Yeah.
So anyways, Bob, shall we talk?
Yeah, let's talk.
Total knee replacement. We'll get serious here. This, if you get your knee replaced, they may have a class for you to go to before your
the surgery.
Before surgery, and they'll give you more than these 2, but these are probably, in our opinion, the most important ones by far.
Yeah, when I have a patient, Brad, I say you can do all the exercises they've shown you and all the ones I'm going to show you, but I want these are the 2 you're going to focus on, and these are the ones like priority. You make sure these 2 get done.
Right, exactly.
So,
and they're quite simple, actually. The first one is, we call them long arc quads, or I say kicks. You're going to do your kicks. So if this is my knee, it's going to be stiff. That's why you're getting it replaced. There's arthritis in there. It's typically lax range of motion and strength. So we want to get, the big thing is range of motion, and we're just going to work like this. And you need a firm chair to sit in, and you want to start with the knee at about a 90-degree angle. You can see with the stripes there. And we don't care if you pull it in this way, because we're going to work that later. And you just simply go up. Sometimes I'll have people hold their knee right here to stabilize that joint, and kick up as far as you can and back down. And do that about 10 repetitions. You can go more than that if you like. Now, if you're unable to straighten it out straight, and it's just stiff and a little painful there, then you do 10 or 15 of these.
Yeah, it's kind of a warm-up almost.
Yep. And before you finish, you're going to get a stool out in front of you and put your foot on there. And if, say, it's tight here, you're going to actually gently push and try and straighten the knee so you get full extension straight. Now, this may not happen the first day you do this, but you're going to start this. This will be the prehab before surgery. You're going to start this a few weeks before surgery, and hopefully by the time surgery comes, you have full extension, and then you can do your kicks full range of motion.
Okay. A little variation of that, Brad, do you mind if I have this stool? Is actually, if you're working on this, you can actually turn the foot one way and press it down, and turn the foot the other way and press it down.
So you can see just his toes going one right or left.
And it's just going to stretch different parts of the knee, and you may find out you get a little more success that way.
That's one of the tricks of the trade.
That's right. One of those tricks from seeing a couple thousand patients.
So this, again, is a prehab. You do your kicks first, 10 or 15, do the stretching if you need to. Then we need to get the knee to bend. And what you're going to do there is go back and forth with your foot on the floor.
Oh, wait. Yeah, there's yours right there.
That doesn't work so well. You can put a towel on the floor, and that works. If you want to do it on carpeting and whatnot, or use an angle like this hand, then we use the knee glide, which actually we invented and works really well, is because we needed one.
Right, exactly.
And a lot of therapists could use these as well as at home. And all you're going to do is go back and forth. Now, you're going to do this, you can do as many reps as you'd like, but at least probably 20 or 30, but you could go 2 or 3 minutes on it, no problem. But after you get the knee loosened up, then about every 5th or so repetition, pull it in as far as you can. You can take your other foot, and you want to get the bend as far as you can. If you can get up to here, that's great. If not, that's not unusual. Some people with arthritic knees maybe only can get to here and it's tight. but with repetition, you can get it moving. And you okay, Liz? She almost
Yeah.
fell off her stool.
No, she's just waking up now.
Yeah. So you're going to do this secondly, and working on that bend.
A nice feature of this, Brad, is that the handle here, and I'll tell you why. My wife was doing this after a knee problem that she had, and the ankle gets uncomfortable when you start getting out here. You see how the ankle's really
Right,
plantar
plantar
flexing there?
flex,
Yep.
yep.
So this keeps it at a nice, comfortable angle, and plus you got the downhill, so
Right.
to help it now
Yep.
stretch into flexion a lot easier.
So you
So
can see it acts as a handle to carry it, as well as you can work it flat or get that incline, which is really a nice benefit.
especially after the surgery,
Right.
that's a huge factor. I think
Right.
that's where the patients really
Right.
really dig this.
So you go into surgery. By that time, you have good range of motion, the best that you can get. After
You
surgery,
got a little bit of strength from the
yep,
quads.
exactly. You're ready for surgery. After surgery, the doctors are going to say, get that knee moving. You're more than likely going to have therapy. This is really a benefit to have at home. And the downhill benefit is really nice. And see, it slides down. There's very little friction on that to begin with. And then you can help here, and you're going to push and push and push. And you want to get after it right away after surgery.
What's nice is you can start around by the ankle first,
Sure.
and then when it gets too far where the ankle can't push as much, then you can put your heel right on
Yep.
the toe of this,
Yep.
and it really gives it a good push.
Yep.
As a therapist, a lot of times what I do is I can sit there, and if I'm measuring somebody, I can come up to them, and yeah, Brad will be on there, and I can actually use my foot
Yes.
to push it
Yep.
while I'm taking the goniometer measurement.
Yep, with both
So-
your hands. It's really handy dandy. So you're going to work that after surgery, but also you're going to do the same thing. You're going to work those kicks. And typically after surgery, it's very common. You're only going to get maybe about this much extension initially. So you do your kicks. You can do 10 to 20 of them.
Again, that's kind of a warm up.
Yep.
And this is the actual exercise.
There
then,
you
is,
go. And then, of course, you're going to have a cold pack is going to be one of your friends to control the pain. You can put a cold pack over your knee and let the weight of the cold and the cold help, mask the pain. So you
yeah,
can get
initially you may
full
not even have to
extension.
push it all. I
Right.
mean, you may want to just like gravity the first
Yep.
couple days or first week.
Yep.
Let it do its thing. A lot, and these stools are nice for this because what happens is it'll start to hurt, and then you can bend it and give
Yeah.
yourself a little
Right.
relief,
Yep.
and then you can go back into it again.
Yeah. So yeah, if
So-
you've got something like that, and if you put the cold pack on there, you're not going to leave it, 30, 40 minutes to straighten out. But usually I'll have someone 5 minutes. It's getting pretty uncomfortable. Then you can take the stool and move it in here, and it feels much nicer.
Right. And there's,
You got to be nice to yourself too when you're doing the post tab.
and despite what people think, physical therapist PT does not stand for pain and torture.
No,
we're
no.
we're nice people sometimes,
We're
right?
here to help you out, but after a knee surgery, there is a little discomfort.
Yeah, unfortunately, that's one of the few things we treat where there is going to be some pain involved
Yep.
with the stretching part.
Right. But if
So,
you do the prehab, it's going to be much better
everything helps.
post tab,
Right.
after surgery. So,
So,
Bob, this is really a good segue to get into our we can fix.
yeah,
just
we can
about-
fix just about anything
Yep,
except
except
for
for-
a broken heart.
Right, exactly. If
But
we
we-
could do broken hearts like we can do knees, we would have no
We
problem.
could fix thousands
Yeah, we
of
could
them.
write books and everything
Yeah.
else. We'd be in
Be like Dr. Phil.
we'd
you know,
be in Tahiti every other weekend.
why Tahiti? I don't know.
Is there a Tahiti?
Yeah.
Have you ever? Is it any fun?
Yeah.